Yeah, hi, thank you. My name is Jared Duncan. I'm a physician on staff at Anne Arundel Medical Center. I also have a private practice in Annapolis and Arnold, Maryland. I'm a member of the American Academy of Ophthalmology, American Association for Pediatric Ophthalmology and Strabismus, and I'm also certified to practice ophthalmology in the United States by the American Board of Ophthalmology. I'm here basically because about a year and a half ago I met Cindy. She had reached out to our practice because she was concerned about the fact that her children were being increasingly exposed to screens while at school. And at the time, I basically kind of felt helpless. To be honest, there weren't a lot of serious randomized controlled trials that directly linked the use of screens to some of the stuff that you saw in this news piece. And therefore, I really couldn't go out on a limb for her and say, listen, this is not something I can exactly support, but I do know where you're coming from. In the past year, however, this has changed dramatically. In the past 2 months alone, I've easily supplied Cindy with four to six scientific studies from major scientific journals, including the Journal American Association for Pediatric Ophthalmology and Strabismus and the Blue Journal put out by the American Academy of Ophthalmology that clearly links some of the stuff that you saw in this news piece. So I'm just going to briefly provide two anecdotes. One was a patient I saw about 2 months ago. He was a 10-month-old boy who was describing blurry vision when he got home from school. After talking to him, he said that he really only got the blurry vision after looking at his iPad, which was supplied by his school. So I asked him to look at his iPad for a minute, and I counted the number of times he blinked. He blinked twice, 2 times in a minute. The normal is once every 4 to 6 seconds. The other anecdote I have for you is your own child or your own grandchild. I think if you're honest with yourself, you look at your son or your daughter and you see them holding a computer, an iPad, a telephone, and you say that there's something not inherently right about that. You picture them in a dark room with the blue light emanating from their screen, and you might ask yourself or tell yourself that something doesn't seem right about this. So all we're asking is for you to take this and extrapolate it to your own children. So I want you to ask yourself a simple question, Do I think that screens are 100% safe for my child or my grandchild? If you can't answer 100% in the affirmative, you owe it to the children of Maryland to pass this bill and put Maryland at the forefront of school safety in the United States. Thanks.